My name is Sandro Galea. I serve as Dean of the WashU School of Public Health. Welcome to Public Health Ideas. These conversations aim to highlight work that advances the science of health and deepens our understanding of the policies and practices that shape a healthier world. Today, I have the privilege of speaking with Dr. Perry Halkitis. He is Dean, Hunterdon Professor of Public Health and Health Equity, and Distinguished Professor of Biostatistics and Epidemiology at the Rutgers School of Public Health. He is also an infectious disease epidemiologist and public health psychologist whose work over 4 decades has shaped our understanding of HIV, LGBTQ+ health, and the social and behavioral determinants of infectious disease. I'm very pleased to be speaking with Perry about his new book, Humanizing Public Health, How Disease-Centered Approaches Have Failed Us. Perry, welcome.
Sandro, thank you for having me.
So let's talk about your new book, Perry, Humanizing Public Health, How Disease-Centered Approaches Have Failed Us. You write in the preface, you had no intention of writing another book, but that watching the mistakes of the 1980s repeat themselves at the onset of 2020 compelled you to do so. Lead us through that decision.
Yeah, I think that line captures exactly why this book exists. I lived through 2 defining pandemics in my life. The first was HIV, which emerged when I was coming of age as a young gay man in New York City in the early 1980s. The second was COVID-19. And what struck me painfully during COVID was not only the biology of the virus, but the sociology and psychology of our response to it. So I watched the same things happening. I watched fear overwhelm reason. I watched politics distort science. I watched public health become tribalized. I watched vulnerable populations once again blamed, marginalized, and left behind. And I watched many public health leaders continue to operate from a paradigm that assumed human beings behave rationally. But, I believe very deeply in my heart, and I've seen enough evidence of this to write that human beings are not rational operators. And so I think this has extraordinary implications for our field. So I wrote this book because, during COVID, we developed or even before and during the last 100 years, developed extraordinary vaccines. We've produced enormous amounts of data. We've advanced virology and therapeutics at remarkable speed. Yet we struggle to control the pandemic because we underestimated the role of emotion and identity and mistrust and politics and loneliness and selfishness and misinformation. So the book became in many ways a call for humility within public health. It became a recognition that biology alone is insufficient. And one of the central arguments in the book is that pathogens create disease, but humans create pandemics. I think this is foundational to the argument. So I wrote the book for this reason. I'm inspired by the work of Hippocrates, who is, from the birthplace of my parents, and this statement that he made or believed to have made, that diseases do not come from gods, but from the foolishness of men. And this statement, written centuries ago, may actually be one of the most sophisticated public health observations ever made. And this was the impetus to write the book, to talk about how we have to address those human foibles.
So this leads me to what exactly I was going to ask. So the central proposition of the book, right, is the shift from a pathogen-centered approach to a person-centered approach, which is, I think, humanizing for the field. Yeah, for those who are new to this distinction, how would you define a person-centered approach, and why do you think it's essential that rather than complementary to the biomedical world work that dominates our response to disease?
Yeah, and I want to not underplay or understate or diminish the role of biology, right? But the disease never exists outside the human experience, and public health and medicine have privileged biology. We study pathogens, molecular mechanisms, vaccines, therapeutics, surveillance systems. All of these things matter enormously. I'm not anti-science. I'm an infectious disease epidemiologist, as you said. I believe deeply in biomedical science, but one of the major arguments in the book is that our over-reliance on biomedical frameworks has caused us to underappreciate the human dimensions of disease. So I say in the preface, I think the sentence is something like, our overemphasis on the biological aspects of disease was the biggest failure with both HIV and COVID-19. And we can tear that apart for the multitude of human mistakes at the person level, at the community level, at the political level. This is a provocative statement intentionally because while viruses are biological, pandemics are social. And so I believe that we need to further explicate and further implement and further apply a perspective to disease that emerges from the interaction of understanding biology with psychology, with social structures, with economics, with politics, with culture and human behavior. And so we need to shift this, in my view, to a person-centered approach. An approach, this to me is what makes it a person-centered approach, that these are human conditions, these are human states And so a person-centered approach asks us to think about a person's thinking and beliefs, works within their belief system, their emotional lives, and their empathy, or may way too often their lack of empathy. So it asks the question, I'm asking us to ask the question in public health, why does a person mistrust the healthcare system? What historical traumas shape mistrust? How do loneliness and stigma, poverty, racism, homophobia shape health behavior? And not only ask those questions, but implement an understanding and an intervention that addresses those issues alongside the vaccines, alongside the masks. And, people are not spreadsheets. We have emotional, social, political, relational lives. We're creatures of all of those things. And if we fail to understand that even the best biomedical interventions, as we saw, will never achieve their full support. I did an interview yesterday about hantavirus, and I pointed to like the 7 cases last year and the 2 deaths, and things are a little more complicated today. But what we're not talking about is the 40,000 flu deaths and the 45,000 COVID deaths last year, right? So if biology was enough, then you know, with antiviral treatment, with biomedical interventions, HIV would be under control. But we have 30,000 new infections of that. So that's what I'm talking about. It's like, why is it that that still happens despite this amazing advances in biomedicine?
So let's talk about feelings. So, your second chapter is about emotions. Emotions are so big they get in the way.
Yep.
Which, in some respects is striking, given that the field, our field's prevailing models are rational decision making. So, talk us through, how do emotions shape health decisions, and what does it mean for public health to take emotions seriously rather than think of it as noise to overcome?
This chapter was one of the most fun for me to write because, I'm a Greek, right? So emotion's very big in my culture, right? Very big in the way I was raised. And we tend to underestimate it in public health, right? We often assume that we provide them evidence through epidemiological data, enough graphs and charts, and people will always behave in ways that protect themselves in society. And I tell this very silly story, and I'm going to repeat it here, that I was a very young researcher in the late 1990s in a room full of amazing, famous HIV researchers. And we were putting together what was then the seropositive men's study and intervention trial. And that was intended to help HIV positive men engage in safer sex practices. And there was all this discussion and all this excitement about self-efficacy, the belief that one could wear a condom, and the belief that if we just could bolster that somehow, people would wear a condom constantly. And, the little wise guy who was sitting in the corner just said, not 5 tequila shots in. And I said that with jest, but I think it really reveals my thinking, right, in this book too, which is that person is not going to make rational decisions, whatever amount of self-efficacy they have, if their emotional lives, in this case, their emotional lives are let fret free and disinhibited in that example with tequila. So for me, shame, loneliness, anger, resentment, mistrust, tribal identity, political allegiance, all shape behavior profoundly. How many people did not take the vaccine because of they despised President Biden? That is not a cognitive reality. And so public health has often underprepared to engage in emotional illness. And I don't know if we do a particularly good job at having our students understand the emotional lives of the people that they work with. And I call upon a paradigm in the book by a Princeton researcher, psychologist, Daniel Kahneman, who worked on this idea of fast and slow thinking to explain how people behave in ways that appear irrational. And he talks about 2 systems of the brain, the system 1 and system 2. System 2, the rational brain, and system 1, the emotional brain. And much of human behavior is intuitive and emotional and fast and identity driven and, not slow, deliberative, and rational. Yeah, maybe it is when you're applying to college. Maybe it is when you're deciding to like spend money on a new car or something. But most of the time in your everyday life, you're making quick reaction. You're reacting quickly, and those are often driven by emotion. So I think we need to stop uplifting emotion and seeing emotion not as an obstacle to science, and start recognizing that it is one of the central mechanisms through which health decisions are made, and at one point of intervention for us to be able to do interesting public health work.
Let's talk about empathy. So in chapter 3, you argue that empathy is both treatment and prevention, which I thought was interesting framing because we don't often think of altruism as a public health intervention. So, how does empathy function as a determinant of health? And as a corollary, what does its erosion, if we believe that in American society, mean for how we respond to disease?
Yeah, so when I was working, before I entered academia, I was worked as a researcher at GMHC for a couple of years. And David Nimmons was the person I worked with at the time. And I remember at the time he wrote an article about altruism and HIV, which I was fascinated with at the time. And then I started to look at the research, and there was this a very limited amount of research on the role of empathy as an intervention. But how I frame it in the book is as a moral virtue, as a potential intervention, because public health depends on our collective responsibility, right? So, vaccination, masking, HIV prevention, environmental stewardship, harm reduction, health equity all require some willingness to care about people beyond ourselves, right? One of the tragedies of COVID, I think, was the extent to which empathy eroded under the pressure of political polarization and hyper-individualism. Public health became reframed through a lens of personal inconvenience rather than communal responsibility. And again, I come back to also my training. I was an undergrad at Columbia, so I read all those great books, right? So I think about the Hobbes and I think about Rousseau and I think about the social compact and the agreement that we all make when we come into a society, which is that we give up a little bit of ourselves for the benefit of all of us. So, but this infectious disease and COVID in particular exposed the illusion that we're all connected to each other, but rather we're somewhat disconnected from one another. And I drew up again upon a quote from another of my heroes, Pericles, again a Greek, who says, and I think this ties with the Hippocrates quote, which is, "We consider him who does not share in the common good not to be idle, but to be worthless," because public health is ultimately the common good, and so we must respect and work with the public in meaningful ways, meeting people where they are, and this is an empathetic stance, which means. And I'm not saying that a person has to forget about themselves. I'm saying we have to be able to develop interventions that show individuals that when they are empathic, it is also beneficial to themselves. So, in some ways, of course, empathy helps the person we are caring for, but empathy also is prevention in some ways for ourselves because we are empowering ourselves with doing something for ourselves that feels good, that enhances our own sense of self, our own self-esteem, and maybe even asks us and uplifts for us the ability to engage in safer behaviors.
So you devote a whole chapter to what you call mythological beliefs, misinformation and
Mhm.
disinformation, as you say, I can correctly kill. So we're in a moment when these falsehoods are amplified, digital technology, political incentive. So how should public health understand the misinformation challenge and what would an effective response look like?
Yeah, this could be a whole book, right? This whole topic. And
Right there.
very, very, very interesting seminar yesterday at ASPPH about this very issue. So I don't see misinformation as an informational problem. I see it as an emotional ecosystem. So I tie it to the emotional things, right? I write in the book that technology has changed the way information is shared and manipulated and how populations are disinformed. When misinformation exploits is not ignorance alone, it exploits fear, loneliness, mistrust, anger, identity, resentment, and belonging. If I wanted to believe that I was a 6'5" blonde man with blue eyes, I could probably find some evidence on the internet to support that, right? Because I could find anything on the internet. So I feel like what we are doing incorrectly can do better is challenge this misinformation using the tools of social networks and the internet in ways that are out communicating us and out sciencing us right now. And schools need to be a public health, in particular, calls to action for people like me and you who are running these institutions and our many wonderful colleagues need to be as adept at teaching regression and doing outbreak investigations and understanding the London fog and all the other things as we are in developing public health influencers. And I'm not kidding about this. If we can create celebrity influencers, makeup influencers, wellness influencers, political influencers, lifestyle influencers, then surely we can train public health influencers. Our students need to study epi and biostats and implementation science and causal inference, but they also need to communicate skills for the modern world. They need to understand podcasts, social media ecosystems, TikTok, YouTube. So information spreads rapidly because of emotional, visual, relational identity and identity affirming. Meanwhile, public health communication too often sounds institutional, distant, and overly clinical. And so, how do we combat it? I think the next generation has to be given the tools to be able to combat it, and we need trusted messengers who can bridge science with humanity. And I think if we can do that, if we can provide the tools, then we are playing at on the same playing field that the people who are misusing information and abusing information are causing harm. We can counter it with the same tools to subdue the harm.
So in your last chapter, you put forward a paradigm, you call it an organizing principle, that brings public health into synergy with clinical care, government, community, and industry, with people at the center and health equity as the end. Walk us through this paradigm and walk us through in particular, what does this ask of us and what would it require to enact it in a school of public health in a city, in a country?
Yeah, I think for too long, public health has often functioned in silos. Medicine focuses on treatment, public health focuses on surveillance, government focuses on policy, industry focuses on markets, community organizations focus on service delivery. But the crises we now face, pandemics, climate change, chronic disease, loneliness, misinformation, addiction, whatever, mental health crises do not exist neatly in these silos. So the model I put forward argues that public health must exist in synergy with medicine and psychology and education. We talk about IPE, interpersonal personal education, all the time when we in public health, but how much do we really live it? And those of us who work in public health, who have the honor of working public health in the field, know that we sit alongside these folks, right? But those folks are not just the usual folks, the medicine, the nurses. I'm thinking about sitting alongside people that are actually working in industry too, because I think that they are a powerful force. So we talk about the commercial determinants of health, and we talk about how commercial determinants may undermine health. But commercial determinants of health, it's one way to look at the way industry operates. We must acknowledge it, whether we acknowledge it or not. Companies and platforms influence how people eat, how they sleep, how they move. We know this, right? And sometimes make bad decisions. So we cannot stand outside these systems. If we put them in this circle, in this model that I put forward, we need to understand them deeply and strategically. Companies like Amazon and Netflix and major digital and social media platforms have become extraordinarily sophisticated in understanding human attention, emotional engagement, behavioral reinforcement, personalization, trust, right? Now, in some ways, these systems can worsen outcomes, but they can fuel the sedentary behaviors that I described. But these companies know how to capture attention. So I'm talking about the model. So I've talked about government, I've talked about community, I've talked about medicine, and I've talked about public health. But I think there's this other big piece here, which is industry, that's part of that circle of people at the table. Um, and I think they are a critical part of it because they have a power and a strength and understanding. They understand the narrative, they understand convenience, they understand identity, they understand emotional connection, they understand how to sustain engagement over time. So public health should not ignore these lessons. We should study them carefully and ask, how do we harness these communication and behavioral insights for a collective well-being? And my answer is by creating a public health model where folks like these industries, these companies are not outside of us, but alongside us.
So someone may hear this conversation and say the book is asking too much of public health, that emotions, beliefs, politics, community trust are not within our reach to shape, and the field should retreat to its biomedical and surveillance score. We can add to this the rise of MAHA and the broader political project that has reframed public health as overreach. So in this context, how do you make the case that the humanizing project you describe is not a luxury, but actually the only viable path forward for the field in the moment?
Yeah, I think it's a big idea, and I think I'd argue that what is unrealistic is believing that we can solve 21st century crises with 20th century thinking. And this idea that I put forward is, an idea that I think is not timid or fearful or overly technocratic, but I think it's actually bold, and it's actually very human. And it's as much a paradigm for moving things forward as it is a moment to reflect on our mistakes, right? So we've made some mistakes over the last, I don't know, 100 years around disease, in the last 5 years around COVID-19 and others, potentially in the future, right? So what I'm saying here is I don't think it's overly ambitious because there is no choice but to be able to um, just step back and retreat. I think the greater danger now is intellectual cowardice, right? So, in a recent interview, I talked about that hope itself is an act of resistance, right? And then I believe that bravery is also an act of resistance. And this is a human characteristic, and this is part of this model. So, public health has to think big, it has to think bold, it has to think proudly, it has to speak truth, it has to own its mistakes and engage with those who we might not normally engage, understand the person who is lining up to get the vaccine as much as we understand the person who is fighting the vaccine, understand and respect that choices of the first person as much as we understand and respect the choices of the second person. The second person is not dumb, is not foolish, is not an idiot. All those horrific terms used. That person gets to the point in their lives where they make these decisions because of life circumstances. And so is it really that bold to ask public health to just care about people and what their realities are? I think not. And so I'm asking us as a community of scholars, to think about research around this area, around how we engage with people in their real lives, in their everyday existences, about putting their lives at center, about being respectful of people, and about teaching our students to be able to go out into the field with that ethos to be able to affect a change.
Well, you alluded to hope. My last question, a positive note. What gives you hope at the moment?
My puppy? No, I would say I would say the new generation gives me hope. The students that I see every day at Rutgers, that I see at places like your school, like students who are saying, you know what? I know public health is under attack, but I'm going to go into this field nonetheless, and I'm going to do this work because I know deep in my heart that if they're doing that with the possibility of not getting scholarships, with the possibility of having to like find their way to pay for their foreign money, that they actually care about the work that we're doing. That's what gives me hope. And I also know that they're going to be able to use their iPhones and the social media much better than I do, and be able to combat the challenges we all face in our lives with this technology.
Perry, as always, a pleasure talking. Your book is terrific. Congratulations on writing it. Thank you for talking here.
It's always an honor to spend time with you, Sandro. Thank you.